Hi, my name is Alan. I'm the author of the book Scary Diagnosis, and I'd like to talk a little bit today about one of the central themes in my book, which is being a proactive patient. Being a proactive patient is a very important part of achieving your best possible results, both short-term and long-term. That's personal results. But I found that in the couple of years since I've written Scary Diagnosis, and in the last 5 years since I was diagnosed with MS, multiple sclerosis, that the term and the concept proactive patient has become a bit of a buzzword or a buzz phrase. You hear it on Oprah and Dr. Oz and The View and shows like that. But really, what does that mean? As a patient, when I was first diagnosed with MS, I went out and tried to read as much as I could, scoured the internet. I tell much of that story in my book about trying to find, first of all, enough information to understand what was happening to me, and secondly, to put together enough good information, factual information, so that I could figure out what kind of plan of attack I could initiate to keep myself and to get myself as healthy and as well as possible. So in order to zero in on the specifics, and there's a bunch of them covered in my book, and I'm not one of those people when you go to my website that, you know, I claim that there are secrets or cures or just pay me X amount of dollars and I'll tell you what I'm doing. I'm very open about what I'm doing. You can get a general idea of what's in my book from my website. You can also search inside on Amazon.com and also Google Books and get quite a bit of information about my book, and certainly many people have chosen to contact me directly, and I'm more than willing to engage them in a bit of a discussion as to what I've done and why I've done it. I realize now that this fantasy, this mythological picture that I had of what medicine and health was all about was one of the main obstacles for me to really move forward as quickly as I could have and should have moved when I was first diagnosed. And in my case, what I thought would happen was I'd be able to find a doctor or a medication or a treatment somewhere, given enough time, money, and research, that I could, with utter confidence, feel like I was either cured or had my condition under control to the point where it would not affect my life on a day-to-day basis. The reality is that we rarely, as a society, understand why we get sick and why we get a specific illness. There's all kinds of theories on pretty much any kind of illness you can imagine, from bacterial to viral to fungal to parasitic to genetic, and of course genetics is a big thing today. And becoming educated and asking good questions and making good decisions, and they won't always be the correct decisions, but trial and error certainly produces some excellent results, and obviously it's always a question of weighing risk versus reward. If you're going to achieve your best possible result, your best personal possible result, it's incumbent on you as a patient and or a loved one or caregiver to educate yourself, ask good questions, and continue to educate yourself and continue to ask good questions. Because one of the fantastic things about dealing with a health crisis in today's world is that not only do we have communications and the internet and access to information, but we have the ability to ask questions and to get varied opinions and apply the common sense approach to those answers, and then hopefully be in a position with the advice of our various advisors to make the best possible choices given the information that we have at our disposal today. the blinders are coming off all over the place, whether it's politically, whether it's socially, whether it's environmentally, and certainly whether it's medically, to put us in a position as patients, as consumers, as taxpayers, to understand that we have not only the right to ask questions and to be part of the decision-making process when it comes to the choices that we're going to make with respect to health and wellness, but we have the responsibility to be part of that process and to take that responsibility seriously, because it just breaks my heart when I get some of the letters that I get, and when I see some of the shows that I've seen with respect to MS, and you see some patients doing well, like myself, and you see others doing so very poorly, and that the only way to know that to know whether you can get those kinds of results is to be proactive and to be constantly learning and questioning and thinking and discussing these issues in a positive and proactive fashion. So, just to summarize, today's little YouTube was about this overused term, although very important term, central theme of my book, being a proactive patient, and what that means, and why it's important, and how you actually do it, and to zero in on the first major stumbling block in achieving that level of proactivity that will yield results for you, and that is overcoming all of these preconceived notions. A more trendy phrase these days is, these paradigms that we have, and these paradigm shifts that have to take place. And to put that into plain English, it's up to us as the patients, the friends, the loved ones, and potentially the caregivers to be a lot more involved and to gain a lot more knowledge, and with that knowledge to gain the confidence to ask the kinds of questions that will really result in us being the kind of educated consumers that we need to be to make the best possible decisions that we can make. Thanks for tuning in today. I have a couple of other YouTubes out there. One's a general overview of my book. It was my first one. I'm a little uncomfortable on it. Sorry about that. But it gets better after the first couple of minutes. One on LDN, a drug that I'm a firm believer in, and that I'm beginning to see more and more in the literature, which is fantastic. There are some clinical trials going on MS and Crohn's disease. There's some work being done with AIDS and that particular drug, and there's potentially some work being done with that and some cancers. So have a look at those couple of YouTubes. There are several more that I plan on doing. I'd also like to say a big thank you to those of you who have written to me not only on YouTube, but also sent me emails directly supporting not only my book, but the efforts that I'm making to sort of bring little bits and pieces of my book's message to the internet via YouTube. And also, certainly, for those of you who have subscribed to my YouTubes. Very nice, thank you, appreciate it. And I'm hoping that we can together continue to spread the word that there are some choices and options, and that there's hope and help out there. Even though my book is called Scary Diagnosis, it's not scary. My diagnosis was, it's helpful and hopeful. Thanks, appreciate it, and here's wishing you your best possible health. Thanks. Bye-bye.